Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of KaramMD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about an especially important and very common topic, which is the treatment and management of the lower eyelid region. People have tons of questions about this because what ultimately happens as this area starts to get aged or through genetic factors, you start to look tired. And nowhere does the aging or fatigue show more than at the level of the lower eyelid. And this is an area that I think, based on all the different types of treatments that are available, we are still left with a lot of questions on how to properly manage this area. And in order to do that, I'm going to empower you all by first understanding what young looks like. What are the expectations of a young looking lower lid? Number two, we're gonna look at what aging looks like, or when genetics has a role in this area. And then number three, we're gonna start to look at what are the different components that are involved in aging this particular region, leading to the darkness and the hollows that we see underneath the eyes. And then finally, we're gonna look at the tools that are available to treat this region. We're gonna look at things from fillers all the way through surgery, and we're gonna understand specifically where those tools fit in the continuum of treatment so that you will be able to drive your own ship and know how and when to treat these specific issues and problems so that you don't get misguided or misled and do things that are not necessarily going to treat the particular problems that you're interested in. This is a wonderful topic and a great piece of information to not only really absorb, but also to share, because I think what is going to follow will enlighten you and feel very, very common sense to you, as well as especially when we show all the different examples of how these concepts come into play. All right, folks, without further ado, let's break it down. So let's start off by understanding what a youthful, ideal lower eyelid should look like. And this is what it comes down to. When we think of young people, when we think of youth, we think of not looking tired. We look like we're not haggard. We look bright, fresh, and attractive. Those are the qualities of a youthful lower eyelid. And what happens to cause that is basically there is a parameter called the lid-cheek junction. And that's the distance between the eyelid and the cheek. And you can see this on the front view, and you can see this on the profile view. And what you're seeing there is that the distance between the eyelid and the cheek, the lid-cheek junction, is short. And what happens is when this distance gets longer, the eyes start to look more hollow, etc. But let's focus for a moment on the characteristics of a youthful lower eyelid. So number one, a short eyelid cheek junction. I bet you haven't necessarily heard that term before, but once you see it in action, it will make all the sense in the world. Number two, you see a lower eyelid that is, generally speaking, on the fuller side. You don't see deep hollows. You see eyes that basically have a certain level of volume, and that volume contributes to eyes that look more fresh and healthy. This is very important, and it's gonna tie directly to the tools in our toolbox. Number three, what you see in the lower eyelid of a young person is no extra skin. Basically just the proper amount of skin that will allow you to look up with your mouth open, which basically puts the skin on stretch without causing the eyelid to evert forward. That's the bare minimum that you need. And that's typically the amount that normal youthful lower eyelids have. You also don't see the presence of bags. There's the puffiness under the eyes, and we all know what that looks like. So the lower eyelid area of a young person can be characterized and summarized as a smooth, mostly convex or flat lower eyelid segment that transitions beautifully into the cheek without having any sharp depressions, hollows, puffy contour irregularities, and extra skin hanging over. Now, we all know what that looks like. We've seen it a million times. We've seen it in ourselves. If you happen to be a little bit more mature in the aging process or have the genetics for it, you know exactly what I'm talking about. Now let's talk about how the lower eyelid ages. Now it's very important to understand, this is the key. The lower eyelid region ages with two factors happening simultaneously. Number one is loss. Loss in the realm of lower eyelid fat. There is a fat pad that sits underneath the bone that transitions into the cheek called the SOOF. That stands for the orbicularis oculi fat pad, which just basically means underneath the orbicularis oculi muscle. Now that fat pad creates a beautiful smooth transition from the bony eyelid down to the cheek. What you see in eyes that have aged is that fat pad starts to diminish, and as a result of that, eyes start to look hollow. So the hollowing that happens goes from the corner of the eye, the medial canthal region, all the way to the outer segment of the eye, the lateral canthal region. So this entire orbital rim, you start to see this crescent shape outline of the bone. The other aspect, so this is loss, right? Minus here. This is what's happening minus. Now there's an addition happening with age as well. And the addition comes in the way of soft tissue. Addition is either excess skin, which is termed dermatochalasis, again, fancy word for just excess skin of the lower eyelid area. And then number two is, in some cases, and not at all, there's puffiness. So what appears to be an excess amount of fat. Now I wanna be really clear because I just made two statements that might seem contradicting. On one hand, I said you're losing fat. On the other hand, I said you might be gaining fat. But I wanna be clear. Everything I'm saying about loss is happening from the orbital rim down. What's happening with excess fat is from the orbital rim up to the eyelashes. That's the true eyelid. Everything below that is the eyelid cheek junction. It has nothing to do with the eyelid. So you're losing fat in the lower eyelid cheek junction region, and in some cases you're getting this puffiness that's coming forward, and I'll explain that anatomy in a moment. So aging is a combination of excess soft tissue and deficient fat. That's the combination that creates the lower eyelid to look tired, haggard, and darkened. And for the most part, not as attractive and bright as it did when we were younger. All right, so let's keep all that in mind, and you see the images to support that, and you have it really clear in your head what that looks like. So I want to point out something, and I want to reintroduce this topic, and that is the eyelid cheek junction. Remember, youth is a short eyelid cheek junction, aging is a long eyelid cheek junction. The distance increases when these factors that I just mentioned are happening simultaneously. So as we go into the tools and we start to see some before and afters, and we start to discuss how this all happens in action, I want you to pay careful attention to the eyelid cheek junction in these cases. All right, so let's open up our toolbox and let's see what's inside of it. So when it comes to the lower eyelid region, I am talking about specifically the way I do it, but I think the way I do it is a pretty good way because the results speak for themselves, and you'll see and understand the logic that is part of my overall paradigm. So number one, we have tools to replace volume. What are those tools? Filler, fat transfer. Two main ways you can replace volume by those two components. Now, we have the excess aspect, right? Well, how are you gonna treat the excess? You've got excess skin, and then you got excess fat. Well, excess skin has its own tool, and excess fat has its own tool. Put all that together, after you've properly assessed the lower eyelid region, you put the tools together, you treat each of these aspects with the proper tools, and guess what? At the end, you've got this beautiful restoration of the lower eyelid segment, and you not only look more youthful and fresh, but you look like yourself. You don't look different, you don't look augmented, the shape of your eyes haven't changed, and this is key. And along the way, you've actually decreased the likelihood of complications as a result of this particular approach. So let's break it down. So tool number one is our volume augmenters, filler. So filler usually comes in the way of hyaluronic acid. Those are popular brand names like Restylane and Juvederm. Now I'm gonna say this, at the time you watch this video, there could be many, many more fillers that are available. And so I'm just gonna speak about this in general terms, not the specific brand names that you may hear about or what happens to be hot for that particular issue at the time that you're watching this. So let's just keep this broad. Hyaluronic acid fillers are made up of a naturally occurring part of the body called hyaluronic acid. Now, hyaluronic acid in its natural form breaks down in about 24 hours if you were to inject it into the body. So what the manufacturers do, they cross-link these together, and that process of cross-linking basically creates a situation where it's harder for the body to break down. Now, as great as all that sounds, there is a negative with hyaluronic acid, and I'm gonna go through all the pros and cons. The negative of hyaluronic acid fillers is that if you inject too much of it, the nature of the hyaluronic acid is that it absorbs water. And when you inject it into an area that's thin like the lower eyelid, it becomes puffy and it actually becomes boggy and blue looking. It's a phenomenon called the Tyndall effect. In addition, they don't, generally speaking, go away the way fillers go away in other parts of the body, in the sense that you might always see a trace of that filler under this area. And if you happen to overfill that region, well, guess what? It's gonna look pretty weird even 2, 3, 4, 5, 10 years out. Super important to note. And how you know it looks weird is there's generally speaking, a little bit of discoloration there and it's a little bit puffy. Now, how I suggest you use the hyaluronic acid fillers for the treatment of volume loss is very simply this. If you have mild volume loss, meaning there's just a little bit of volume loss, mostly in the tear trough, just this corner here, it should require between 1/4 to 1/3 of a syringe of filler per side, and that's it. If you use that quantity and really use it like once a year or once every other year, guess what? You probably aren't gonna see the complications or the issues that I just described, and it'll be a proper treatment, really good treatment for that particular area. Now, who benefits from this? Typically people in their 30s for the most part, maybe early 40s if you're kind of losing volume at a little bit of a slower rate. So what happens if the volume is a little bit greater? It follows, all the way around the orbital rim, which it will, through the general evolution of volume loss. In my opinion, fat transfer is the way to go here, because in order to treat this whole region, you're gonna end up using almost a full syringe per lower eyelid region, and this is where things get a little bit messy, because all of that hyaluronic acid into that area causes puffiness and swelling, which you're not gonna like the look of it, especially if you end up doing it 2 or 3 times in a row, which you will, because when volume loss is that significant, you're gonna wanna fill that area up until it's full. Now, the problem also becomes with the fillers is we get greedy. We want to fill that area up to its maximum level. But guess what? The normal lower eyelid level in a 20-year-old and 30-year-old is actually a little underfilled. There's a natural hollowness that happens under the eyelids that's okay to have. You don't need to fill it all the way up to the hilt. When you do fill it, it's just supposed to be a little bit better. Now, same goes for fat transfer. Fat transfer I like a lot. Now let's talk about that for a second. That's my augmenter replacement of choice, because it's natural, it comes from our own body, there's no inflammatory process to break it down, your body accepts it, it doesn't reject it, and because of that, what ends up happening is when you transfer it from the stomach or the thighs, wherever you're taking the fat from to inject into this area, it becomes a permanent part of that region. Now, I did not misspeak there. Fat transfer is a graft. Grafts, when they're taken from one part of the body, put into another, if they're done properly, your body will accept them and they will become permanent. So fat transfer is a permanent way to replace lost volume, and if it's done in a very, very proper way with an experienced injector, it's gonna look beautiful and it's gonna look subtle and it's not gonna look overdone. Now, I'm gonna just say this for a second. This is the piece to keep in mind before you just run out and say, oh, I'm gonna go get a fat transfer. Fat transfers are difficult to perform. I hate to say it, and it's nothing new. It's been around for 40, 50 years, but up until this date, very few surgeons have really dedicated themselves to becoming proficient and good at fat transfer, which I can't understand because it's such an important part of the facial rejuvenation process, especially in the eyelid area. I do them every single day. I've been doing them every single day for almost 20 years. I don't get lumps and bumps. I don't overfill the area. We, generally speaking, have a very smooth course with them. It works every single time. It's a beautiful treatment. So I'm speaking from my own experience. Now if you're gonna replace the volume in that area with fat transfer, it's up to you to make sure that the surgeon you choose knows what they're doing in that area. You've got to see lots of before and afters, and you have to really, really trust the aptitude and skill level of the particular surgeon. All I'm gonna say about that. Now let's open up the other side of our toolbox. How are we gonna treat the excess skin, and how are we gonna treat the puffiness? Now, this is something that, again, is gonna sound super logical, right? If you have excess skin, you're gonna snip the extra skin. You snip the extra skin by a technique that I perform called a skin pinch. I'm not the only one who performs this. I'm just terming it the way I term it in our practice. It's called a skin pinch, which just basically means we pinch the excess skin in that area and then simply trim the excess skin. Now, the trick of that procedure is knowing how much skin to leave, not taking too much, because if you take too much, the eyelid will pull down. If you take the proper amount, you literally have removed the extra skin in that area, and that sloppy, kind of loose look in that region disappears. And it's a very, very simple procedure to recover from, and it is beautiful when it's done. Now, I'm gonna preface it by saying this. Again, in my practice, I would never do a lower eyelid skin pinch or blepharoplasty without a fat transfer. And the reason is because it's almost impossible for you to have extra skin under your eyes and have that aged, hollowed look without having volume loss. And if you don't replace the volume, which I consider kind of paramount, you're still gonna look tired because the eyes will still be hollowed and sunken, you might have less skin. So there's no point to doing it without volume augmentation. This is really important. I've learned it the hard way. I've done it on certain patients without doing the fat transfer, and it's always come back to bite me. It's probably been 7, 8 years minimum that I've refused to do a lower eyelid surgical procedure without doing a fat transfer in addition to it. That's, again, my sort of learning experience I'm sharing with you. You share that perspective with it with your surgeon and hear their thoughts on it, but that's how I do it. Now, taking out extra skin, that's a skin pinch. Now, what happens when you have puffiness under the eyes? So this is an important kind of anatomic point to understand. Having puffiness under the eyes or the fat pads, that's not the same as saying that you have suddenly grown extra fat in that area. That's orbital fat. That's the fat that lines the eyeball inside the eye socket. It's there to protect your eyes from bouncing around against the bony walls of the orbital socket. But here's what happens. Some people have a weak, we call a septum, that divides the orbital compartment with the eyelid. It's just basically, just think of it as like a wall. And that wall is made up of a tissue fabric we call the septum. So when the orbital fat pad puts pressure on the septum, it starts to bulge forward. And it creates what's a condition called pseudobags, which just means that it's not an actual bag, it's just basically what appears to be. And that pressure on the septum happens because some people genetically have a weaker orbital septum, and as a result, it pushes forward with age or genetics. Now, how are we gonna treat that? There's several different surgical procedures that are available for that, all under the umbrella of lower eyelid blepharoplasty. Now, in my practice, I perform a technique called a transconjunctival lower eyelid blepharoplasty. And what that means is that I pull the eyelid down and I go from the inside of the eyelid to get to that fat pad and basically just trim a little bit of that puffy fat pad away so that it doesn't keep that pressure on the septum, and it basically makes the appearance of a bag disappear. Now, the reason of going from the inside of the eyelid is because the anatomy of the lower eyelid is that there's skin, then there's muscle, and then there's a septum, and then there's the fat. So if you're going from the inside, you're never touching the muscle of the lower eyelid area, and that enables the lower eyelid to maintain its strength and integrity, so you don't get that issue, or you get a lot less likely of the issue of the eyelid pulling down. That's an important, general point about performing this with safety absolutely in mind. So when I perform a lower eyelid procedure where I'm taking out fat, I do it from the inside of the eyelid. Now, there are other techniques called transcutaneous, which means they go through the outside of this area and then they go down into the muscle and they remove the fat pad that way. Now, the problem with that is that there's a higher chance of the eyelid pulling down, and therefore a lot of surgeons will then take the eyelid and then tether it up, here called a canthopexy, to support the lower eyelid so that doesn't happen. I don't like those type of procedures because it ends up changing the shape of the lower eyelid. And to me, that's a big no-no. That's a non-starter. We need to keep the essence and the spirit of the eyes completely untouched. So, transconjunctival lower eyelid blepharoplasty is my tool for removing the fat pad. Skin pinch is my tool for removing excess skin. And in a lot of cases, those are combined. In many cases, it's just the skin pinch alone because it's more common to have excess skin than it is to have puffiness under the eyes. But in all cases, fat transfer comes together. So that's kind of the trifecta of lower eyelid treatment, is bringing all those different parts together when they are all involved together, but not in every case there are. Sometimes it's just volume loss, sometimes it's fat loss in addition to excess skin, sometimes it's a combination of three, as we just mentioned. So those are our tools that are available to us in our toolbox. What isn't in my toolbox that you may have heard about is things like laser resurfacing to tightening skin or different energy devices. Not a fan of any of those. If I want to remove skin, I'm going to remove it directly under my vision and make sure that I get what I want out and make sure that I leave what I want behind, and never to affect the quality of the skin. Because one of the things that happen when people do deep resurfacing on the lower eyelid skin, it's already thin to begin with. And then when you do that type of treatment, you end up causing extra thinning of that region, which over time can become an issue. So that, my friends, encompasses the understanding and treatment of the lower eyelid area. So let's take a look at a few before and afters. Let's take a look carefully at these qualities. So as you can see in this before photo, and all the before photos, you're gonna see that the quality of volume loss exists. Hollowness under the eyes and kind of a deepening darkness under the eyes. So that's number one. You can see this very clearly. Number two, you can see there is extra skin involved as well. So when you see that extra skin, you're like, okay, boom, skin pinch out of the toolbox. The other aspect that you can see in this particular before photo is the presence of fat pad. Now this puffiness under the eyes, again, pretty common scenario, not ubiquitous the way skin and volume loss is, but it's pretty common. This is what it looks like. In all of these cases, you can see the eyelid cheek junction is long, right? Compared to what we showed earlier, which showed what a young, short, lower eyelid cheek junction looks like. So now, let's take a look at these before and afters. What they look like is a refreshed, bright looking eye without any evidence of surgery, right? Shape looks the same, the eyes overall look the same, the essence looks the same, spirit looks like they just look less tired. There's not the hollowness, there's not the puffiness, there's not the excess skin. And as you review these before and afters, pay close attention to that eyelid cheek junction, and you'll notice that before it was long and after it's a lot shorter. And this is ultimately what a good before and after should look like. It doesn't need to be perfectly filled. That's not the criteria of a good outcome. A lot of people mistake this because they're so used to using fillers to kind of fill to the hilt with this type of an issue. That's not where you want it to be. You just want it to look a lot better, a lot more fresh, and a lot more youthful without looking different. And that is a successful outcome. That's what we should be thinking about. All right, folks, I hope this helped bring some light onto a very, very interesting, common, and important topic, because empowerment and understanding how to manage the aging process in all of its forms, whether it's your skin, whether it's your jawline and neck, whether it's your eyes, all of this stuff means a lot to us as individuals, and we want to get it right, and we want to make sure that we're doing the right things. And I hope this gives you some understanding of the processes as well as the treatments and how to achieve that. All right, like always, my friends, if you enjoyed this, hit like, comment below if you have any questions, subscribe if you haven't already, and definitely send it along to some friends and family. We want to get the word out. We want to help people find these messages in this simple fashion, this simple form, so that people can be in the driver's seat. All right, folks, thanks again. Appreciate it. Until next time, Dr. Karam.